Let's just start with how relatively narrow this scope is of who the FDA says could get a shot. Do you think it's too narrow?
I think that the decision makes sense. I mean, the FDA looked at the data, the CDC presented to the FDA, and you had a really good discussion at the advisory committee. It'll be people who receive the Pfizer vaccine who fall into these different categories based on the fact that there looks to be some reduction in protection over time from the Pfizer vaccine. I think we'll see recommendations for the other vaccines pretty soon. You know, big picture, I think these boosters will be somewhat helpful, but not a game changer for the people who receive them. We're talking about a modest decline in effectiveness and a little probably temporary bump up from the booster. The really important thing, though, is to get people who are totally unvaccinated vaccinated. That's just a huge jump in protection.
How do you do that, Josh? How do you incentivize people? I mean, there's been a number of, people, big companies saying you can't come to work if you're not vaccinated. I think you could also enter in the free, in some states, the lottery. Is there anything else that the U.S. and especially states can do?
Well, I think it's really important to be very persistent with outreach efforts. That's important. I think the mandates work in getting more people vaccinated, particularly people who need this for their job. I go out vaccinating, and most of the people coming in are saying, look, I got to get it for my job, and it's probably a good thing anyway. I've been just putting it off. So I think that is that's another way to do it. I'm a little worried that if if the entire focus goes to boosters, that will lose energy in that effort to keep getting people vaccinated. So it's just going to be really important to balance out the need to follow up with boosters, give people the ability to get boosters, but press forward for those first shots. That is really going to be the thing that helps the hospitals and just reduces the pressure of the pandemic.